Every single year, millions of people lose their lives to a disease that gave them plenty of warning signs, signs they simply did not recognize in time. What if one of those signs is already happening to you right now, and you have no idea? Colon cancer, also called colorectal cancer, is one of the most dangerous diseases on the planet, not because it is impossible to treat, but because it is so incredibly quiet in the beginning. It grows slowly, deep inside your body, while you go about your daily life completely unaware. By the time most people finally feel something is wrong, the disease has often moved far beyond where it started. And here is the part that truly matters for you. According to the World Health Organization, colon cancer is the third most commonly diagnosed cancer in the world and the second leading cause of cancer-related deaths globally. Every year, more than 900,000 people die from this disease, and the risk increases significantly after the age of 50. If you are watching this video, you are in the group that needs to pay the closest attention. What makes this disease so dangerous is not just how common it is how easily the early warning signs are dismissed. A little tiredness, must be getting older, some changes in the bathroom, probably something I ate, a few dark spots on the skin, probably just age. And while people explain these things away, the disease continues to grow. The good news is that when colon cancer is caught early, the survival rate is extremely high. Major cancer research organizations worldwide report that people diagnosed in the earliest stage have a survival rate of over 90%. That number drops dramatically the longer detection is delayed. Are you aware of the 5 strange, unexpected symptoms that colon cancer can produce? Symptoms that have nothing to do with your stomach. Do you know why some people in their 60s and 70s are diagnosed too late, even when they thought they were paying attention to their health? And do you know what the single most powerful step you can take right now is to protect yourself and the people you love? Stay with me until the very end, because I am going to answer every one of those questions. Before we continue, if you have not yet subscribed to this channel, please do that right now and tap the notification bell so you never miss content like this. Tell us in the comments, from what part of the world are you watching today? We would love to hear from you. Now let us talk about what colon cancer actually is, because understanding the disease makes it so much easier to recognize what it does to your body. Your large intestine, which most people call the colon, is a long tube in your lower abdomen whose job is to absorb water and minerals from digested food and move waste out of your body. Colon cancer almost always begins with small growths called polyps forming on the inner lining of the colon. Most polyps are harmless at first, but a specific type cells called an adenomatous polyp can slowly transform into a cancerous tumor over the course of many years, sometimes as many as 10 to 15 years. This long, slow development is actually a gift, because it gives us a window of time to catch and stop the disease before it becomes truly dangerous. The problem is that polyps and early tumors cause no pain and no obvious symptoms. Think of it like a wide river. A single rock on the riverbed barely affects the flow of water. But as that rock grows into a boulder, and then the boulder into a dam, the consequences become impossible to ignore. Over time, if the tumor is not found, it begins to invade deeper layers of the colon wall, reaches the lymph nodes and blood vessels, and can eventually spread to other organs like the liver, the lungs, and the bones. Understanding this process is exactly why early screening saves lives. Warning sign number 1. Changes in your bathroom habits that just will not go away. This is the most well-known warning sign, but it is also the most misunderstood because the changes are often so subtle that they seem completely ordinary. We are not talking about one bad day in the bathroom. We are talking about a persistent shift that lasts for several weeks with no clear explanation. These changes can include your bowel movements becoming narrower or flatter than usual, as though something is pressing on the inside of the colon. You might go more often than normal, or less often, without any change in diet or routine. Your stool may look darker than usual, sometimes almost black, which can indicate bleeding higher up in the colon. One particularly important symptom is the feeling that you need to go again even right after you just did, as though your bowel is never completely empty. This is known medically as tenesmus, and it is one of the classic early signs that something in the colon is interfering with normal movement. Researchers at major international cancer institutes have consistently found that persistent changes in bowel habits lasting more than 3 weeks are among the most reliable early indicators in patients later diagnosed with colorectal cancer. The practical point here is simple. You know what is normal for your body. When something changes and stays changed for more than 2 to 3 weeks without a clear reason, that is your body sending you a message. Write down what you are noticing and bring it to your doctor without delay. Warning sign number 2. Blood in the stool, visible or completely hidden. Finding blood in the toilet or on the tissue is a sign that many people notice but desperately try not to think about. If you have ever told yourself it was probably just from something you ate or just a small internal tear, please listen carefully. Blood in the stool can absolutely come from something minor like hemorrhoids, which are very common after 50. But it can also be one of the earliest and clearest signals of colon cancer. Only a doctor can tell you which one it is. The blood may appear bright red, meaning it is coming from lower in the colon, or it may be very dark and tar-like, meaning it originated higher up and was partially digested on its way down. Both are medically significant, but what makes this sign even more dangerous is that in many cases the bleeding is completely invisible to the naked eye. The tumor bleeds slowly in very small amounts, and the blood becomes mixed in with the stool in a way you simply cannot see. This is called occult blood, which just means hidden blood. It is detected by a specific laboratory test that checks stool samples for traces of blood that no eye can find. The World Health Organization and cancer prevention organizations worldwide strongly recommend this test for adults over 50 as part of regular health screenings. If you have not had this test recently, speak with your doctor. It is painless, simple, and it could make all the difference. Warning sign number 3. Constant tiredness and shortness of breath with no clear cause. If you are feeling more tired than usual, even after a full night of sleep, and sometimes feel dizzy or short of breath doing things that never used to bother you, you might assume this is simply part of getting older. And sometimes it is. But sometimes it is your body telling you about a serious problem in your colon. When a tumor in the colon bleeds in tiny amounts continuously over weeks and months, the body gradually loses iron-rich blood every single day. Iron is what your body uses to produce hemoglobin, the protein in red blood cells that carries oxygen from your lungs to every cell in your body. When iron levels drop too low, you cannot make enough healthy red blood cells. This condition is called anemia, which simply means your blood is not carrying enough oxygen. And when your body is running low on oxygen, you feel exhausted. You feel dizzy when you stand up. You feel breathless climbing stairs or walking across the room. Your heart beats faster than usual because it is working harder to compensate. In people over 55, this gradual, unexplained tiredness is very easy to attribute to age or stress. That is exactly what makes it so deceptive. Research from major hospitals has found that a significant number of colon cancer patients had been living with iron deficiency anemia for months before their diagnosis, never connecting it to their colon. If you or someone you love has been persistently pale, tired, or short of breath without a clear explanation, a simple blood test can check iron levels and red blood cell count. That small test could be a critical first step toward answers. Warning sign number 4. Unexplained weight loss without trying. Most people over 50 have spent years working hard to manage their weight, so when the scale starts going down without any changes to diet or exercise, the first reaction is often relief. But unexplained weight loss, especially 10 pounds or more without trying, is something that medicine takes very seriously. When cancer is growing inside the body, it disrupts the normal processes that control weight. Tumors consume energy and nutrients the body would otherwise use. Cancer also interferes with how the intestine absorbs nutrients from food. Additionally, the immune system releases chemicals that suppress appetite and speed up the breakdown of stored fat and muscle. The result is weight loss that happens even when you are eating normally. You may also notice loss of muscle tone, general weakness, and a decreasing appetite you cannot explain. Foods you have always enjoyed may suddenly seem unappealing. In older adults, changes in appetite are sometimes accepted as normal aging, and occasionally they are. But when combined with persistent fatigue, changes in bowel habits, or any other sign from this list, they form a pattern that must be evaluated by a medical professional without delay. Your body is like a well-managed household. If resources start disappearing without explanation, something is wrong. Pay attention to those signals. Warning sign number 5. Strange, dark, thick patches appearing on your skin. This is perhaps the most surprising warning sign of all, because it has nothing to do with your stomach or your digestion. This sign appears on your skin, and most people would never connect it to colon cancer. The condition causes patches of skin that become dark, thickened, and velvety in texture. These patches most commonly appear on the back of the neck, in the armpits, and in the groin area. They are not painful and they do not itch. They simply look and feel different from the surrounding skin, darker and slightly raised, like a soft, velvety discoloration. Many people notice these patches and assume they are age spots or skin reactions, and in many cases, this condition is related to insulin resistance or pre-diabetes, which is also common after 50. But in some cases, these dark patches are the body's response to an internal cancer, including colon cancer that is producing abnormal amounts of certain growth-related hormones. The skin is essentially signaling a problem deep inside the body before any digestive symptoms have appeared. Medical literature has documented cases where patients came in for this skin change and were found to have early-stage colorectal cancer during follow-up testing. If you have noticed these types of patches developing where they were not before, bring it to your doctor's attention. It is a simple thing to have examined, and it could be a critical early clue. Warning sign number 6. A serious heart infection that started in the gut. This one is so unexpected that even experienced doctors, who are not specifically looking for the connection, can miss it. The condition is called bacterial endocarditis, which simply means a serious infection of the inner lining of the heart. Here is how colon cancer creates this connection. The colon normally contains billions of bacteria that are completely harmless as long as they stay inside the gut. But when a tumor grows in the colon, it can damage the protective lining of the intestine, creating openings through which certain bacteria migrate into the bloodstream. From there, they travel through the body and can attach to the inner surface of the heart, causing a potentially life-threatening infection. A specific type of bacteria that lives naturally in the colon has been particularly linked to this process. Researchers discovered decades ago that when a patient develops this specific type of heart infection, there is a high likelihood that a polyp or tumor is present somewhere in the colon, even when no digestive symptoms exist yet. Symptoms of this heart infection include a persistent fever, unexplained chills, unusual fatigue, and shortness of breath. If you have ever been treated for a heart infection and your doctor did not recommend a colonoscopy as part of the follow-up, especially if you are over 50, it may be worth having that conversation. The gut and the heart are more connected than most people realize. Warning sign number 7. Severe abdominal pain and bloating that feels like something is blocked. Most of us have experienced a stomachache. Gas, indigestion, and bloating are very common experiences, especially after a heavy meal. But the kind of pain and bloating associated with a growing colon tumor has a specific character that is important to recognize. When a tumor grows large enough, it begins to narrow the passage through which waste travels. Imagine a pipe that is slowly being constricted from the inside. The waste that needs to pass through can no longer do so easily. This creates a buildup of pressure and gas that causes significant bloating and cramping. The pain tends to be persistent rather than quick. It may be accompanied by loud gurgling sounds from the abdomen, a feeling of fullness even without eating much, and difficulty passing gas. In more serious cases, the blockage can become severe enough to cause vomiting and a complete inability to have a bowel movement, which is a medical emergency requiring immediate attention. Even before reaching that extreme, persistent cramping on one side of the abdomen that returns regularly is something worth discussing with your doctor. This type of pain does not resolve after an hour the way a typical stomachache does. It lingers, returns, and gradually worsens. That pattern is a signal your body is asking you not to ignore. Now that you understand the warning signs, let us talk about what you can actually do. starting with the most important steps you can take beginning this week. The single most effective tool for catching colon cancer early, treat, and even for preventing it from developing at all, is a procedure called a colonoscopy. During this examination, a doctor uses a thin, flexible tube with a small camera to look directly inside your colon. If any polyps are found, they can be removed during the same procedure before they ever have the chance to become cancerous. Medical organizations worldwide recommend that adults begin regular colonoscopies between the ages of 45 and 50, and earlier if a parent, sibling, or child has been diagnosed with colon cancer or with certain types of polyps. If a colonoscopy is not immediately accessible to you, speak with your doctor about alternatives. A stool test that checks for hidden blood can be done at home and sent to a laboratory. A stool DNA test can detect abnormal cells shed by polyps or tumors. A scan of the abdomen can provide detailed images of the colon without any internal procedure. Any one of these may be the right starting point depending on your individual health situation and what is available to you. Beyond screenings, daily habits matter greatly. A diet rich in fruits, vegetables, legumes, and whole grains provides fiber that keeps the colon healthy and moving efficiently. Think of fiber as a gentle brush inside the intestine, clearing out waste quickly so that harmful substances do not linger in contact with the colon lining for too long. Reducing red meat and processed meats has been consistently associated with lower colon cancer risk across large international studies. Staying physically active, even with gentle daily walks, reduces inflammation and helps maintain a healthy weight, both of which protect the colon. Limiting alcohol, not smoking, and drinking adequate water each day round out a practical daily approach that is gentle, sustainable, and fits easily into the routine of most people in their 50s, 60s, and beyond. These are not dramatic changes. They are quiet, consistent choices that support not just your colon, but your overall health and energy for the years ahead. Before you go, there are a few important cautions to keep in mind. Everything shared in this video is based on established medical research and global health guidelines, but it is not a substitute for a personal conversation with your own doctor. Every person's body is different, and your doctor knows your individual history in a way no video ever can. If you are taking medications for heart conditions, blood pressure, diabetes, or blood thinners, it is especially important to discuss any planned screenings with your doctor in advance. And if you experience a combination of the symptoms discussed today, particularly if more than one is present at the same time, or if they persist beyond 2 to 3 weeks, please make an appointment promptly. Early action is the single greatest act of self-care you can offer yourself and the people who love you. Thank you so much for taking the time to care for your health today. If this video was useful to you, a like helps this information reach more people who truly need it. Share it with a friend or family member you care about, someone who could benefit from knowing this, and leave a comment telling us what surprised you most, or what topic you would like us to cover next. You will notice there are 2 more videos on the screen right now. I have a feeling you are going to want to keep watching. Take good care of yourself. You deserve it.